Tension ran high in the operating room. Eve Grant, for 2 years scrub nurse to the city hospital's leading surgeon, Dr. Richard Avery, knew that this was a special day. The operation had not been scheduled, and a routine surgery case had been postponed, so this patient could be wheeled into the big green and white room at exactly 9:30. The patient, an eminent political leader, was suffering from a pulmonary embolism. Eve was familiar with the condition only from her textbook reading. It was a clot of coagulated blood or embolus, which was blocking the patient's pulmonary artery. She knew that it always happened suddenly and was regarded as a severe threat to life. From Dr. Avery's briefing, she knew the block had occurred above the heart, where the artery divided into 2 branches, one leading to the left lung and the other to the right. Dr. Avery stood at the table studying the patient while she tied on his mask and put on his cap. The instruments nurse had set out the special sterile items needed for this surgery: scissors, forceps, scalpels and probes, tweezers, needles, syringes, and big retractors. Among them, she noted the sponge forceps for removing the clot. The patient was covered except for the operating area, which had been cleaned with alcohol and painted with iodine. Eve saw the anesthesiast check his equipment and knew he must be worried about the patient. "Very well, let's get at it," the tall, gray-haired Richard Avery said. Eve, who had been holding the scalpel with 3 fingers immediately behind the edge and the handle, turned away, passed it to him, and he made a quick incision from the sternum along the 2nd rib. The team in the operating room now concentrated on their united effort. Surgeon Avery's deft hands worked their magic, keeping Eve busy passing swabs, forceps, a new scalpel. Avery directed an inquiry to the anesthetist. "How is he?" "Weaker." The single word fell on the room with grim impact. "Shouldn't be too much longer," Dr. Avery said. A few minutes later, the obstacle had been eliminated, and the blood was flowing normally again. The tricky bit of work had seemed like child's play because of the surgeon's great skill. The stitching of the pericardium was begun, and then the wound in the outer skin taken care of. As the final stitches were completed, Eve saw the patient taking a really deep breath for the first time since the operation had begun. It was close to noon when the patient was wheeled away, and Eve helped Dr. Avery out of his gown. The old surgeon smiled at her. "We don't get too many like that, I'm thankful to say," he observed dryly. "It seemed to go well," she said. "I'd say so," he agreed with a nod. "You can always run into a crisis the first day or 2 following surgery. After that, we'll be in the clear." Eve had great respect for the senior surgeon's judgment. He was never overly optimistic, and while he had been known on occasion to take risks, they were always calculated ones. She asked, "What about the achalasia case?" "This afternoon at 3, Richard Avery said. "It will provide no problems." Eve knew this was probably true. Since Dr. Avery specialized in thoracic surgery, she had assisted in this particular operation a number of times. It was performed to relieve a spasm of the esophagus when the condition became so serious the patient suffered from a progressive inability to swallow. Unless something quite unexpected happened, she knew she would be free to leave the hospital at 4, her usual end of the day. Richard Avery left her with the words, "I think we've earned a good luncheon." Eve remained behind a few minutes longer to supervise some of the cleaning up of the operating room, then went out to wash and go into the hospital cafe for her lunch. She had been at Glassville's City Hospital for 3 years and felt it was one of the most advanced in the Midwest.